Hi, I'm Marina G, and today I am mad. Today I want to talk about racial inequality in healthcare in the US. Hi, my name is Marina G, and this is my channel Mind Bloom, fighting cancer one mind at a time. And in this particular episode, we're going to be fighting institutional racism as well. So stay with me. Racial inequalities in this country are excessive, through the roof, especially in healthcare and especially in breast cancer, since that's the topic that concerns me the most. So in this video, you'll find out more about racial disparities in healthcare and in particular in breast cancer, because I have with me a perfect, amazing, beautiful guest, Dr. Alexea Gaffney. She is going to tell us more about her diagnosis, her course of treatment, how she's doing now, and what she faced and faces every day as a doctor and a breast cancer patient in the hospitals in the United States. So stay with me. I am positive you're going to adore this episode.
So I am Dr. Alexia. I am a triple board certified infectious disease physician. I am a mom, a speaker, an author, an advocate, and a cancer wellness coach. And all of that other stuff, which is so important to me, came out of being diagnosed with stage 3 breast. I was diagnosed with breast cancer at the age of 37. I had a large tumor in my right breast with significant lymph node involvement, and was found to have also a small tumor in my left breast after I underwent bilateral mastectomies. I always tell people that my breast cancer diagnosis was 2 years in the making, and I was known to be high risk. Yet I received, disparate care, really. And only after I was diagnosed with breast cancer was I diagnosed with a genetic mutation. I'm a PALB2 genetic mutant that increases my risk for breast cancer, ovarian cancer, pancreatic cancer, and I have an ATM gene variant of undetermined clinical significance, and as a physician who is very passionate about educating my own patients and educating my community for things that we're at high risk for, when I got thrust into the breast cancer community and began to understand even more about risk factors for Black women, Latino women, and other women of color, and just based on my own experience navigating the healthcare system, I thought, my God, if this could happen to me, what is happening to women who look like me, who aren't physicians, who aren't healthcare professionals, who aren't going to, university medical centers, and being taken care of by people who they know and, hold them in a particular regard. And so I began to share my story. And as I was sharing my story, as well as looking for information about what I was about to experience, I noticed two things. I noticed that there was a lack of representation for Black women. So wanting to know what my mastectomy scars might look like. I couldn't find imagery of that. And then I noticed there was a lot of misinformation or a lot of half-truths being put out there. And so my concern is we're already underserved, we're already at a disadvantage. And because we may not be getting our questions answered in the healthcare setting, if we're turning to social media, if we're turning to, different groups and organizations, if we're being faced with misinformation, what I noticed is that some of the information was not representative of and not applicable to Black women. And so I really made a conscious effort to share my experience in real time and make sure that I was educating women in my community along the way. And granted, other women definitely benefit from what I have to say and what I have to share. And I want everybody to benefit, but because we have not been represented, especially young women, I really made it my mission to make sure that we were educated, that we were prepared to advocate for ourselves, so that when we go into healthcare systems that don't understand why the rules don't always apply to us, or why, you know, you have to really manipulate the standard of care in order to best take care of us. You know, I just used all of that to be a stand for changing that 40% disparity in our outcomes as it relates to breast cancer. And so many things have happened along the way. And so as I've been going through the cancer treatment process and, you know, the survivorship process, I'm learning more, and I'm just taking a stand to educate others and just really bring other women along the way with me.
Yeah, I saw your post yesterday I believe yesterday on Instagram about that 40% disparity.
Yeah.
I myself post that all the time as well. It's not enough. You have to keep repeating it and saying it out loud.
Yeah.
Somehow there's still the idea, and I think it's natural because it's a difficult topic, obviously, but we all read that, and we still have the idea that, you know, it's okay, 40%, but it's not going to happen to me.
Yeah.
And you can never say enough. Do your mammograms, do your follow-ups. If you're not under the age of a mammogram yet, self-advocate if you do feel something, or if something is up. Please say to everyone, for everyone to hear here again, what is that 40%? What is that disparity? What are we talking about? Is it just, I know, but is it just diagnoses? Is it also the outcome? So the survivorship and the mortality rates. What does this involve, and what are we talking about?
So Black women are 40 to 42% more likely to die of breast cancer compared to our white counterparts. And that is regardless of age, regardless of stage of diagnosis. It takes into consideration all of those things. And even though we've had so many advances in breast cancer diagnosis and breast cancer treatment, the disparities have actually increased over time. So years ago, when they started recording this kind of data, it was low as 10 to 12%. And then that disparity gap has sort of widened over the decades. And, you know, sadly, it also is variable from place to place. So what city you live in, what types of cancer care centers you have access to, is it an accredited cancer institution or a university hospital? Do you have access to research or not? And all of these things play a role. So across the board, there's this 40% disparity that Black women are more likely to get, more likely to die from a cancer diagnosis. And there's several reasons that occurs. And when I, look at all these different, large cancer institutions, they all have the same data on their websites. They all say it's related to education, it's related to socioeconomic status, all of these things. But what it boils down to is that Black women get diagnosed with breast cancer younger. We often get diagnosed with more aggressive breast cancers, like we're more likely to be triple negative. And we're really underdiagnosed for genetic mutations. And we know that understanding genetic predispositions for cancer can sort of guide and direct care. And so there's all of these things that end up being missed in terms of diagnosing us and caring for us. We're less likely to be offered genetic testing. And so that is an issue because that may change or affect a Black woman's outcomes. Our family history is less likely to be known and understood. And that boils down to just, historical and present day racism in this country. We've not had access to healthcare historically in this country. And then when we have, it's been disparate. And so if you ask, a Black or Latino woman, or possibly even an Indigenous woman about their family medical history, they may not know what somebody's primary cancer was. They may just know that, some of their family members died of cancer. And so then we're told, well, we don't meet criteria for genetic testing or for early screening and things like that. So the NCCN guidelines have had to go as far as to say that if you have a Black patient who has cancer, you need to offer them genetic testing and counseling, because using his family history and other criteria, many of us have been missed. And the same thing happened to me. I was told that I did not have a significant enough family history of breast cancer to be offered genetic testing, but I have a strong family history of prostate cancer. My grandfather died of aggressive prostate cancer. My father had prostate cancer. And that actually was enough to get me tested, but it wasn't done until after I had breast cancer. And so if I, as a physician, had this outcome because I, at the time, just didn't advocate for myself. I said, these are my doctors. They're the experts. This is not my specialty. I'm going to trust them. I'm going to stay in my lane and do what my doctors tell me to do. And for me, I ended up with a cancer diagnosis that I didn't have to have. I was denied a prophylactic mastectomy that I asked for, because I was told it was too radical. And, you know, my stance and what I say when I'm speaking to physician groups, when I'm advocating for Black women who experience breast and other cancers, I say, there's nothing that is too radical for a group of women who are 40% more likely to die than the rest of your patients, right? How can you say that any intervention, any screening, any protocol is too radical if someone is 40% more likely to die? So there's just so many levels and layers to why this occurs. It's yes, there's a lack of education, but it's not how educated the patient is or isn't, because having a medical doctorate didn't change my outcome. So we have to stop blaming patients that they're not educated enough to survive cancer. You know, our healthcare providers need to be educated and need to be more culturally competent and need to be more thoughtful and considerate about the group of people that they're taking care of and how they apply the medicine to individual patients or individual groups. You know, if there's a lack of education, it's that. We can't just blame patients' level of education for their outcomes, because it has almost no impact when you talk about the education differences in white women. So we know that that's not what's going on here. And then there's other factors, environmental factors. There, you know, where does someone live, right? Do they live in a food desert? You know, what kind of food, what quality of food is being sold in their community? Because we know diet plays a role in risk for cancer. But so many people are told when they get a cancer diagnosis and when they start chemotherapy and radiation, eat whatever you want, eat whatever you can get in. And, you know, they're told not to eat, you know, certain foods. Don't eat raw fruits or, you know, raw veggies, or don't eat, you know, fruits that don't have a skin or a rind when they're on chemo. But patients shouldn't be told that. They should be told how to prepare and handle the food to decrease the risk of infection. So, you know, I know cancer patients who are in the midst of chemotherapy and they're eating like McDonald's burgers, fries, and milkshakes because it's cooked. It's not raw. You know, it's not a food that's going to place them at high risk for infection, but we shouldn't be eating like that during chemo. So it's this kinds of things and so many other layers, you know, this idea that, you know, Black women or Black people are poor historians. And so the complaints we report aren't taken seriously and not acted upon. So there's just so, I could go on indefinitely. We could take the whole podcast talking about this thing, but there's certainly more opportunities and, you know, more time to share about those things.
So basically, thousands of lives could be saved.
Yeah, if we properly educate people, if we help people understand their own risk and how lifestyle can play a role and change outcomes. You know, if we encourage and educate people about the importance of treatment, you know how many people, you know, don't go through cancer treatment because they're afraid of what chemo is going to do to them. And they've never talked to another person to really understand, you know, how what cancer treatment can look like, or understand that it's not as hard or barbaric as it was, 20, 30, 40 years ago. People don't go into treatment because they're afraid of how sick they might be, not having any understanding of how amazing, cancer treatment has, the evolution of cancer treatment and how patients can be supported, how amazing and effective some of these medicines are, that, nausea can really be limited, that you can go back to your cancer center and get hydration, for example. And we just don't know. And, what we don't know can really kill us. So people, run away from treatment just out of, or fear of pain. And so even just the proper education of that, and just having providers who are committed to bring people back who are, falling out of care, who are missing appointments, who didn't show up for chemo, like encouraging them to get back on course.
Would health care costs play a role in it as well?
Absolutely. Healthcare costs definitely play a role in people not being able to pursue cancer treatment, like being afraid of the mounting costs, as well as the treatment putting them out of work. So if you are, a mother or a grandmother, and you're the sole provider for your children or your grandchildren, which can be the case, especially in our communities, that can make women put off care or not go into treatment altogether. But they need to have the conversation, because, I talked to my doctor and I talked about working through treatment, and, in the beginning, she was like, well, let's see how it goes. Let's see how you do. We can schedule your work schedule so that, you get your initial treatment, and you'll likely be okay for 48 to 72 hours after chemo, because of how long some of these preventative anti-nausea, anti-vomiting medicines and the steroids work in your system, and then they'll sort of wear off. So my chemos were usually on like a Tuesday or a Wednesday, with the goal of me being able to work Thursday and Friday, and then kind of go through the roughest patch on the weekend when I didn't have to work. And, that worked actually for a while. I actually had to leave work for like chemo brain, and because my white counts were so low, before, things got too crazy. But like, I didn't have to not work because of nausea or vomiting or profound fatigue in the beginning. So what she said was true, and we were able to work that out. But it's so important for patients to have that conversation with their providers, as well as with someone who's had this lived experience. If you're a mom and you have children at home, talk to another mom who's gone through cancer and see how she managed, raising a child, especially if it's a school-age child or a small child. Like, see how that woman navigated going through cancer treatment while having small children, and, doing homework and work and all of those things, before you just deny your treatment and say, no, I can't. I have too much on my plate. I have children to take care of. I have bills to pay. I got to work, etc. And explore resources. There are so many financial resources out there that we just don't tap into. And we have to, in that regard, release pride, release this fear of being stigmatized, and just, go after what's available. I was someone who, as a physician, I was very resistant and very prideful about, not applying for certain programs. And like, I remember my cousin set up a GoFundMe for me, and she was like, you should fill in this thing and activate the account. And my pride would not let me do that. And what we have to remember is that people have a choice to give, whether they're giving directly to us or they're giving to, organizations that provide financial resources, big, small, and everything in between. People choose to give out of the kindness of their heart. And we should not let pride or stigma or anything else get in the way of us being vulnerable enough to to help ourselves out and to give ourselves a break. You know, vulnerability is huge. It will carry you far, far, far in the cancer treatment journey. I'm such a stand for saying yes to help. I'm such a stand for being receptive to what other people may have to offer you, big or small, when you're going through cancer treatment, and just letting go of that pride. You know, cancer can financially devastate people. And yet again, Black women are disproportionately impacted in a negative way by the financial burdens of breast cancer. And breast cancer is one of the most financially burdening cancer diagnoses there are. And so, you know, just see what resources are out there. Even if you have to work, there's resources to pay your rent or your mortgage, resources to pay for transportation to and from your appointments, resources to pay your utilities, you know, donation of grocery store coupon. You know, my community was incredible. They set up a meal train and people would sign up on a calendar to prepare lunch or dinner for my family, or, you know, drop off a gift card so we could order food. And that was such an amazing resource. And so, you know, rely on your community. When people say, what do you need? Say, I need a meal train. What do you need? I need grocery store gift cards. I need my electric bill paid. I need my rent paid. You know, my fellow physicians, women physicians got together. I had no idea they were doing this. They collected money for me. And it was like a mortgage payment and a half. And that was so huge because I lost my income. I lost my ability to work and be generative. And the fear of not being able to pay bills costs women their lives every single day, every single month, every single year. And, you know, that disproportionately impacts Black and brown women, Latino women. And so I never want to see that. So if it takes for me to say, even as a physician, I struggled financially, you know, that the things that I had set in place, like disability insurance, weren't enough to cover my bills. But I was ultimately became vulnerable enough to ask for the help. So that, you know, a year, 2 years, almost 3 years later, I'm still in my home that I worked so hard for, that I could have lost to cancer, you know? So when you talk about, you know, all of the things that we're up against, you know, especially with breast cancer, you lose your breasts, some of us lose our ovaries, you lose your hair, you lose your independence, you lose your financial well-being, and then things like your home, your transportation, all of this stuff is at stake. I really want to encourage women to be vulnerable, to ask for help, seek help, and accept help. Because we as a community, we don't do that.
I see.
We don't do that.
I see. I love this raw description you just gave, because, you know, we talk about cancer, breast cancer in particular, and we're, oh my gosh, the chemo, oh my gosh, the loss of hair. But it's this whole disruption and interference of your life. Everything. You have to tell your kids or choose not to tell. You have to, I mean, there's so many, the grief, the loss, and you mentioned counseling as well, you know, it being available to women going through breast cancer. All the areas in our lives are transformed and just disrupted, and so much more if, yes, like you're saying, you're a single mom, or help with your electric bill, or oh my gosh, it's unbelievable. Yes, thank you for sharing all of that, because it's definitely areas you don't talk about.
And I think because people aren't talking about it, nobody thinks to ask. And certainly, you know, as a physician, I'm like, I want women to advocate for themselves, but I also want us to be reasonable and realistic about what it is our physicians can and are supposed to do for us. And so your physician's not going to think of that, but ask to speak with a social worker at the cancer center, regardless of what your financial abilities are, because I'll tell you, I had that 6 months of money saved, that everybody tells you to save, that emergency fund that you're supposed to have. I had that, and it was gone way quicker than 6 months, and so we don't want to be in a position where we're just so financially depleted if we don't have to be. So it doesn't matter what your income is. It doesn't matter what your job title or your role is. Ask for social services. Find out what resources are out there. And really begin to take assessment of like what your financial needs and burdens may be, because your physicians may not think about it, because our finances are not their responsibility, right? Physicians treat, physicians cure, physicians get us into remission. They have an agenda and a standard of care that they have to meet. Then we have our stuff. But we have to have realistic expectations, and we have to know where to get what from. So those kinds of resources we need to get from social services, and we need to get from our cancer support community and groups and things like that. And it's out there. But if you need a referral to a social worker, then definitely ask your physician for that. Because sometimes we just don't know. And a lot of times in the community, I hear people saying, my physician didn't do this. My physician never told me that. I'm like, well, but they're the doctor. They give you the cancer treatment. They give you the appropriate referrals, but they also are not mind readers, and they can't anticipate every single need. So if you have a need, you have to ask for it. But sometimes we don't know what we need until we're in the midst of it. And that's the importance and the value of being in community.
Mm-hmm. Oh my God, this is unbelievable. Thank you so much.